Hi, this is Chris with Toward Optimized Practice. And in this video, we're going to look at how to do reports on validation rates in your EMR. And to do that, we'll go to the reporting section. But before we do, I think it's worthwhile to just have a quick look into a patient's chart and talk about a field in the demographics tab. And the field I'm talking about is this one here, the demographics validated. This is a relatively new field in the EMR, and we're able to report on it, which is great. And the intent of it is that when you've had a conversation with a patient and confirmed their demographics, and also confirmed their attachment to their primary provider, that you can then click in here, click Today to set the date, and click Update. That records that you've had the conversation with the patient and they have confirmed their demographic information and their attachment to their provider on this day. Now that we've done that, we can report on it here in the reporting section. And if we'll open up the demographic section of the reporting, you can see down here there's a validated since field. That's the same field that we just checked on in the demographics before. To report on validation rates, basically we want to report on how many patients were validated in a certain period of time versus how many patients actually came in that same period of time. So to do that, we'll need two reports. The first one will be how many patients were validated. So we'll just look back a week and then do a quick search to see how many patients actually were validated in that time. So a quick search shows us that 1, 2, 3, 4 patients were validated in the last week. So that's the number of patients validated. But how many patients actually came in? And to do that, we'll need to open up the visit section of the reporting. Here in the visit section, we'll also look back a week. And we'll do a quick search to see how many patients were in. And I can see 1, 2, 3, 4, 5, 6. 6 patients came in. So we validated 4 of 6 patients. Our validation rate is 2/3 or 66%. And depending on what you're aiming for, that may be good enough, or you may want to adjust your processes to make sure that more patients get validated as they come in. So that's fairly simple, but of course, if you have a lot of patients coming in, this method is maybe not going to be worthwhile to you because there'll be too many patients to count. So here's a quick way to just get numbers out of the EMR as opposed to lists of patients. And I like to just use these because they're right at the top. So if you just choose the age histogram and hit the printer, we get the age histogram, and we don't care really about the age breakdown of these patients. We just want a patient count. And the nice thing about the age histogram is that on page 2, in the bottom right-hand corner, there's a count of patients. So there's our 6 patients. And we can do the same thing with the report that we did in the demographics area. Again, just do an age histogram and get a quick count of patients. Hopefully this is helpful. Thanks for watching, and have a great day.